Minister of Health, Dr. Osagie Ehanire, says the federal government is committed to scale up universal health coverage, UHC, in the country through the National Health Insurance Scheme. Ehanire said this at the opening of a strategic stakeholders meeting with donors and implementing partners in Abuja, organized by NHIS. Ehanire, represented by Dr. Joseph Amedu, Director of Hospital Services in the ministry, said the ministry was committed to implementing various health initiatives in the country.
Implementation of the mandatory healthcare insurance scheme to achieve universal health coverage. The Federal Minister of Health is also to scale up the implementation of the Basic Healthcare Provision Fund in collaboration with all the states to ensure the achievement of universal health coverage. And to address human resource gap, especially at the facility level. The ministry was also tasked to revamp federal tertiary health institutions across the country to provide quality healthcare to Nigerians, and to revamp the tertiary healthcare services across the country, including actively collaborating with the private sector to ensure the provision of quality healthcare system. And in doing this, the Ministry of Health is to establish a functional and responsive emergency medical services across the country to ensure that the public health emergencies are appropriately taken care of. I therefore urge you to use this opportunity to develop the relevant framework, parameters, and a sustainable coordinating mechanism that will ensure that we get value for every effort to position National Health Insurance Scheme properly for the attainment of universal health coverage in Nigeria.
In his remark, the Executive Secretary of NHIS, Professor Mohammed Sambo, told the stakeholders that the organization had commenced the implementation of BHCPF to expand healthcare coverage in Nigeria.
Also recall that recently the scheme, in collaboration with the Federal Ministry of Health and the state government, have commenced implementation of Basic Healthcare Provision Fund to extend and expand healthcare coverage to all Nigerians, especially the vulnerable group of vulnerable segment of the population. This is in line with the provision of the National Health Act, which was signed into law in 2014. And to that end, we have already disbursed about 6.5 billion naira from the NHIS gateway to about 15 states who have fulfilled all the criteria for the implementation of the Basic Healthcare Provision Fund as outlined by the steering committee. This development has opened a new vista in our quest toward attainment of universal health coverage, which is currently the core mandate of the National Health Insurance Scheme.
In his goodwill message, Dr. Francis Ukwije, health economist with World Health Organization, said NHIS was critical to achieving UHC.
For any country to achieve universal health coverage, three things are involved. So one is population coverage, the second is service coverage, and the third one is financial risk protection or cost coverage. Interestingly, none of these will be achieved without the National Health Insurance Scheme in Nigeria. We hope that we will, as much as possible, support them to activate their insurance schemes at the state level to be able to provide, because we believe that that will be the platform to quickly improve coverage, population coverage on essential health services. It is our hope that the implementation of the Basic Healthcare Provision Fund will be properly done to be able to achieve the desired outputs and outcomes.
Nigeria is a very big country. We cannot afford to continue doing things as one. The states have to each take their own responsibility and look after their people on their own. That is why the state health insurance is also very important, and they're all doing it one by one. So it's important. Thank you. It is spending out of pocket, but now that the NHIS has come on board and it has a good and vibrant leadership, it will be done.